We start with the anesthesia, the numbing gel. Once that works, we use the proper anesthesia with a needle. We put in the Optragate, which will help retract your cheeks so that we have a better access and view. Once the anesthesia works and you don't feel anything anymore, we start drilling. We start with these ones. They are the diamond burrs, high-pitched noise, a lot of water. They are the best thing to use to remove all filling material or the hard outer surface of the tooth, the enamel. Then we switch to those burrs. With those, we are able to remove the soft dentin, the one that is infected. When we're done with the drilling part, we start prepping for your actual filling procedure. We will put this thing in, the bite block, which will help to keep the mouth open, and it will be more relaxing for your jaw. Next step is that we put in a lot of cotton rolls and cheek pads or even a rubber dam just to keep the saliva and blood and everything out of the way. Once that's done, we will start putting those matrices around the tooth, in between teeth, depending on how we need the isolation for your cavity. We will secure it with holders like these and with wedges. Once that is done, we switch to the actual procedure. We start with the etching gel. We will leave that for 15 to 30 seconds on your tooth before spraying it away. Next step is to apply the glue, the adhesive, which is sensitive to light, which is the reason we have it under orange covers, or why we switch to orange light during the procedure. We will use that little brush and apply the liquid adhesive in your tooth. And then once it's applied, we will cure it with the light cure for a couple of seconds. When that's done, we switch to the filling material. We mostly start with a flowable material. It's soft and liquid and is very good to seal the cavity floor, which again is cured with the blue light. Then we switch to the more packable material, the stable one, which is like a Play-Doh if you want. We put it in little pieces, which we adapt with such instruments. We dab it in. Once it's in the place where we need it, we light cure it for a couple of seconds again. We do that piece by piece by piece until the cavity is filled. And when we're completely done with the whole filling, we remove all of that cotton rolls and whatever is in your mouth. We check for the height. So this is where this paper comes in, blue-sided, red-sided. You will bite on it, you will leave spots on the fillings so that we know where to adjust it. We will polish the filling with different burrs or Soflex discs just to give you a very smooth surface. No pointy edges, no roughness is left. And then you're basically done.